I am Bhupen Desai. I am practicing as a cardiologist for the last 25 years in the city of Mumbai. Vitamin D is a very important vitamin. It has a lot of hormonal function. It has been associated with the bone and mineral metabolism. It is very important for the health of bone. Vitamin D deficiency is very common in uncontrolled diabetics, hypertension. It has some role in the renin-angiotensin system, so it can be implicated indirectly in the genesis of resistant hypertension. It has been found very commonly in obesity as well as in people who suffer from atherosclerotic disease. We all know about this. Something which we don't know, something which has not received the full attention about vitamin D is its role in the immunomodulation. It's a very good immunomodulator. There are two types of immunity in the body. One is innate immunity and other is specific immunity. Innate immunity is the first line of defense. Whenever we get any viral or bacterial infection, innate immunity is the one which takes the first line of defense. Vitamin D has been associated with this innate immunity. Vitamin D receptors are there in neutrophils, T cells, B cells, natural killer cells, macrophages. It is also expressed in the endothelial cells of the lungs. So whenever a body is attacked by any virus or a bacteria, this vitamin D receptor in the fighting cells gets activated, and those who have vitamin D deficiency have a poor innate immunity. In this era of COVID infections, there has been a lot of renewed interest in the role of vitamin D or effect of vitamin D deficiency in COVID infection. Vitamin D somehow produces a sort of antimicrobial peptides. It's called AMPs. And these are small peptides which are the first line of defense against any infection in the body, which includes viral infections also. There has not been many studies in adults about the role of immunity and vitamin D deficiency in adults, but there are few studies in children and the infants. There are some studies in tuberculosis. 100 years back, when there was no antimicrobial agents for treatment of the tuberculosis, these patients were treated with cod liver oil, which is a very good source of vitamin D, and exposure to the sun. So 100 years back, people realized the importance of vitamin D in the treatment of tuberculosis. There are 3 studies in children from India in tuberculosis. People who had tuberculosis were found to have a low vitamin D level. In fact, as high as 86% of children were found to have low vitamin D levels who were suffering from tuberculosis. Some of the data is very controversial about supplementation of vitamin D, whether giving vitamin D will cure TB or not. But definitely, vitamin D supplementation has helped in reducing the duration of treatment for tuberculosis. Similarly, in lower respiratory tract infections, there are data from Japan and Turkey, particularly pneumonia, which has shown that if you have low vitamin D levels, particularly in children and infants, they get more severe infections. In fact, there are studies in which they have given low dose supplementation and high dose supplementation. One group received 400 international units per day, other group received 1200 international units per day. And those who were in high dose supplementation did very well in the treatment of their pneumonia. There have been some reports in the influenza also. Studies from Japan and China have shown that vitamin D levels are very helpful in preventing influenza or in the treatment of influenza. In fact, a study from Canada has shown that when you give high dose of vitamin D supplementation, incidence of influenza can be reduced by as high as 50%. Vitamin D receptors are there in the endothelial cells of the lung also. So the question arises whether this will help in tackling COVID infections or not. We all know COVID infection is a lung infection primarily. Will it play any important role in controlling the symptoms or outcome of COVID infection? We don't know. We still don't have the answer. But theoretically, yes, because vitamin D deficiency is very common in Indian population. It may or may not help once you give a supplementation, but it will definitely not harm. So in my opinion, we should aggressively look for the vitamin D deficiency in the population and treat it correct it, and hope that if they get lower respiratory tract infections, they will do well. Thank you so much.